This morning, I have the honor to introduce a remarkable woman. Rebecca Alexander is one of only 100 people in the United States with Usher syndrome type 3, a genetic disorder that causes progressive hearing and vision loss and generally leads to deafness and blindness. At the age of 12, she was told she would be deaf and blind by the time she was 30. At 18 years old, a fall from a window broke nearly every bone in her body. Despite this catastrophic injury and the ongoing deterioration of her sight and hearing, Rebecca remains hopeful, athletic, and inspirational. The book that she wrote about her experience with Usher syndrome, Not Fade Away, a memoir of senses lost and found, has been featured in both People and Shape magazine, and she has just celebrated a paperback release. She runs a successful psychotherapy practice in New York City, holds 2 master's degrees from Columbia, and teaches spin classes and participates in endurance racing. In July, this remarkable woman even summited Mount Kilimanjaro with her sister and stepmother. Please welcome Rebecca Alexander.
Can you hear me? Yeah, okay. So I'm standing in the front here because I do some demonstrations with my cane, and I'm so sorry for those of you in the back who likely can't see me, but I will tell you what I'm doing as I'm doing it. So I will tell you just briefly about my diagnosis. I'm taking an hour-long talk and condensing it into 30 minutes, so go with me here. So I was diagnosed with retinitis pigmentosa at the age of 12. I had difficulty seeing the blackboard at school. My dad decided to take me to an optometrist. The optometrist said, there's something in the back of her eye. Our equipment is not sophisticated enough to diagnose what it is. You need to take her to an ophthalmologist. I grew up in the San Francisco Bay Area. We went to UCSF. We went to Stanford. We were very fortunate to have that access to go to both of those institutions. And they both said, your daughter has RP, which many of you are very familiar with. So that was at 12, and at the time, we didn't really know that there was anything wrong with my hearing. I think I had a cookie bite of hearing loss, which we assumed was associated with having ear infections frequently as a child. So, when I was 18, I actually had a fall from a window, and there are no pictures with this slide because I absolutely refused to let anyone take a photo of me at the time. And this was actually my first experience with disability, because I broke everything in my body except I didn't break my right leg or my right foot, and I didn't hit my head, fortunately. It was a night after my senior year of high school. A big group of us decided to go out drinking, and I ended up falling out of a window when I was brought home that night by some friends, and I'm very, very fortunate to be alive, as you can imagine. I was told I would never walk properly again. My left foot was supposed to be fused completely, and they were able to give me range of motion, thankfully. I was in a wheelchair for 4.5 months, and this was really my first exposure to what it feels like to live in the world with a disability, and much more pronounced than having a visual impairment. Oh, age 20, okay. So, I was at the University of Michigan as an undergrad. I woke up one morning and I had really loud ringing in my ears, and the sensation was that I couldn't hear people speak over the really loud ringing. You know, if you've ever left a really loud rock concert, sometimes war veterans come back and they say that they're hearing really loud ringing, tinnitus, as we all know it, and I had that same sensation. And after about a week or two, it hadn't gone away, and I thought, well, I should probably go and get this figured out. So I went to the medical campus at the University of Michigan, and I saw an otolaryngologist, and he said, after all of the tests that they performed, Rebecca, you don't actually just have RP, you have something called Usher syndrome. We've never seen it as it presents itself in you, but it can't be anything else. At the time, there was only Usher syndrome type 1 and Usher syndrome type 2. And for those of you who are unfamiliar, Usher syndrome type 1 is where you're born completely deaf and you're losing your vision. Type 2 is where you are born with a set amount of hearing loss, and you are also losing your vision, but you are not progressively losing any hearing. And type 3, which is the most recently identified, which is what I have, and thanks to my blood work, it was identified. It is the combination of both vision and hearing loss. It's generally the mildest onset. I'm very, very fortunate to have type 3 because I was able to develop speech at a young age. And had I had the hearing loss that I do now, I would have very seriously affected speech. So I'm very fortunate for that. So it was around this time that I really started wearing hearing aids. And at the time, they didn't have the type of sophisticated technology they do now. And so it felt like I had two boom boxes on the side of my head. So one of the things that I did when I was at the University of Michigan is I went home one summer, and we were trying to think about, well, what are some of the things that I need to plan for in terms of having a diagnosis like this? And again, when someone tells you that you're going deaf and blind, how possibly can you comprehend what that means? If, for all intents and purposes, you've always been able to hear and see, right? I mean, it may not be the best hearing and sight that maybe other people have, but that's what you use to navigate. And so I didn't really know how to handle it. And I sort of decided I wanted to make myself look as perfect and be as normal as everybody else. And so I decided that if I studied as hard as I could and I exercised as regularly as I could, I would look like everybody else and nobody would know that there was anything wrong with me. And before I was able to actually accept the fact that I really needed to wear hearing aids, that this was sort of a part of my life and that it wasn't just a diagnosis, this was really going to be a part of who I am. One morning, I went to the University of Michigan, and my day I was, how do you say it? I was a bit of a jersey chaser. And for those of you who are unfamiliar with what that means, it means I liked football players, basketball players, you name it. So I had a class, a writing class, and there were a couple of football players in that class, and it was the Friday before we were playing Notre Dame, and I went to a Big Ten rah-rah school, and for those of you who don't care about that, it's huge at Michigan. And I wanted to look like everybody else, and I wanted to wear my Michigan hat, and I wanted to wear my hair back in a ponytail, and my ears would have to be exposed, right? So I decided I'm going to this writing class, and I'm not wearing my hearing aids. I want them to see how much spirit I have and that I'm just like everybody else. And so I went to that writing class, and I sat there for 2 hours, and I heard nothing. I heard absolutely nothing. And I was very fortunate that the professor didn't call on me. And to be honest, I wouldn't have even known if she had, because I hadn't heard a thing. And I realized when I left that nobody was being held back except me by not wearing my hearing aids. And there are many things that we do, if you can sort of apply that to your own life. What are some of the things that you do to go out of your way? To go out of your way so much so that you're putting yourself at a disadvantage to cover what it is that you're really struggling to come to terms with, or that you're really struggling to adjust to in your own life. So I went home one summer, and my mom encouraged me to do my mobility training with the Department of Rehabilitation. And I was able to register, I was qualified, and there were a lot of free services that were available to me. And for some reason at the time, I thought free services were really cool. So I decided I was going to do my cane training when I was home one summer in California. And when I was 16, I had enough vision that I was able to get my driver's license. So I always drove during the day. I never drove at night. I went home that summer. I made my cane training appointment, and I drove to my cane training. So if that's not freaky to any of you to see someone park their car and then get out and unleash their cane, yeah. Interesting. So I did my cane training, and of course it was during the day, and my day vision was quite strong. As we know, with RP, in the early stages, your night vision is most seriously affected. And so I figured, okay, I got this down. Maybe I'll need this at some point. It's a free service. No harm done. I got a free cane. I took my cane, I went home, I folded it up, and I put it in my junk drawer with all the other stuff that I never use, right? So I went back to the University of Michigan. There was a pilot course being offered in sign language, and I figured, great, I'll take sign language. Who knows, maybe I'll need it. But more importantly, I thought sign language was a really cool language. It was so cool to see people sign, and I never knew what they were saying. And so I figured this is another skill I can learn. Maybe I'll need it down the road. Probably not, because this Usher syndrome isn't really going to happen. I mean, this is just what my diagnosis is, not my prognosis, right? So I graduated from Michigan, and I moved to Los Angeles, and I lived with my twin brother and a friend of ours in an apartment. And I got a job working at a terrible photography syndication agency where they do all of the awful airbrushing and everything that I sort of preach against, and I ended up working at a place like that. So the other irony about that situation is that I was the receptionist answering phones. So when my hearing aids broke and I had to pick up the phone, I gave it my best shot and then passed it along to whoever I thought it was, and I would say about 72% of the time I was wrong. So I moved to LA, and it's always around this time of year, and you will notice this with your patients. They may tell you around daylight savings that they feel like their vision has gotten worse. And when I speak to groups of people who are visually impaired, they all say the same thing, that it's around daylight savings they feel like they've had a dip in their vision. They feel like their vision has gotten worse. And for some reason, it took me about 4 or 5 years to recognize that actually my vision may not have gotten worse, it was just that it was getting darker earlier. And you think with 2 master's degrees from Columbia, I would have figured that out right away, but I didn't. So many people will express this, and so it's something that's good to have in the back of your mind, because it's very scary when it happens. So it was around daylight savings this time of year. LA has the worst traffic. There are a lot of other places that could probably compete now, but at the time, it had the worst traffic. I was driving home. It was getting close to 5 o'clock when it gets dark, and I was in standstill traffic. I very fortunately just made it home to my apartment before the sun had completely gone down. And I was very afraid, and it wasn't that anybody was waiting for me to make sure that I got home safely. But I knew that I was not supposed to be driving at that hour. And I knew that when it got darker, I had a much harder time seeing, and people were using their headlights by then. So I parked my car, and I went into the apartment, and luckily my brother and our friend were not home. And I decided that I needed to get my cane out of my junk drawer. So I took my cane, and I went out to the street, and I figured, man, I should probably give this a little practice. This was a real eye-opening experience, no pun intended, to have been driving in the dark. And so I went out to the street, and as I got to the crosswalk, the trees were hovering over this street, and there were very few street lights. And I made myself to the corner, and I saw a man pull up with his car, and his headlights were beaming forward, and I willed him to keep driving so that I could have this experience on my own. And of course, he saw a woman standing there with the cane and probably wanted to make sure that she got across the street safely, and so I took a big sigh, and I made my way across the street, and I used my cane. And as I made my way in front of his car, I felt the beams of his headlights illuminate my entire body. And so by the time I made it to the other side of the street, you can imagine my face was streaming with tears. It was such an exposure. I was so vulnerable. It was such an announcement to the world that I am blind, that no matter what else I am or what I've done with my life, people will know that I need help, that I'm a disabled person, and that first and foremost, they will judge me for my cane. I hated it. It made me sick to my stomach. And I took my cane and I put it back in that junk drawer, and I never wanted to see it again. So I decided that living in LA probably wasn't the best place for me, given how much you need to drive there. And as I was there, I'd always been very active in the community. I participated in the AIDS life cycle ride. That was how I sort of distracted myself from hating Los Angeles so much. And I'm sorry for those of you who are from Los Angeles, just not for me. Anyway, so I was training for the AIDS life cycle ride, a 600-mile bike ride from San Francisco to LA. And on the 5th day, we were making our way down the PCH, the Pacific Coast Highway. And as we made our way down, we were in a lane that actually wasn't a lane at all. I mean, it was just sort of a lane we'd created for bikes. And on the left side of us was traffic going about 80, 90 miles an hour. And on the right side of us, we had a guardrail and just a cliff of rocks that went straight down to the ocean. And as I was riding, I was thinking to myself, well, what doesn't keep me from just veering into traffic or just veering off the side of this guardrail? And you know, when we really, really get our minds going, we can really sort of think ourselves into oblivion. I mean, we can think ourselves into insanity almost, right? And so in that moment, I had about 40 more miles to go, and I did the only thing that I could think of, and I came up with a mantra. And the mantra was, and still is, I use it to this day, breathe in peace. I breathed in through my nose, and I breathed out through my mouth. Breathe out fear. Breathe in peace. Breathe out fear. And that made me get through those next 40 miles, and to this day, I still use it. I used it on Kilimanjaro, and it really helped me in times of fear. And I always recommend to people to come up with their own mantra, something to help you when your mind starts to really start racing and you get anxious. So, I mean, come on. That's Olive. Cutest stinking thing ever. Not a guide dog, but I will tell you about Olive. She, when she sees me come in the room, gets out of the way because she's right in my field of vision that's just not there. So she knows when Mom comes around, I'm probably going to get stepped on. So she moves. And for those of you who are, just to give you a sense of what my vision is like, and I'm speaking to a group that can probably really understand this. So as we know, a normally sighted person has about 180 degrees, and I have 10 degrees of my centralmost vision. I have donut vision, so I have a very small sliver of vision out here, my periphery. I can see my hands here. I can't see my hands, I can't see my hands, I can't see my hands, I can see my hands. Hard to explain that, right? I'm sure you guys have all seen that. Okay, so I decided to move to New York City. This was going to be a place where I wouldn't need to drive. I would be in the same boat as everybody else. And I did my master's degrees. I went on and did my psychoanalytic, psychodynamic training. And one night it was around daylight savings, and I was walking to my office. And I had just moved to a new apartment, and so I was taking a new route. And the good news was, I was walking down a street that was a clear pathway. There was nothing in my way, and that was good because I was running late. I wanted to make sure I got to my office before my patient did. So I'm hustling as fast as I can, making my way down the street, and I keep going, and then smack, right into a steel gate. I wasn't using my cane. I didn't need my cane, remember? So that was a huge shock, as you can imagine. And as I dislodged my knee from between these two steel poles and hobbled my way to my office, I realized that I was really putting myself at a disadvantage, that I thought I was on a street that was completely clear. And it was, except there was a steel gate right in my way. And it wasn't like I caught myself before I ran into it. I ran into it as though it didn't even exist. So it scared me into a bit of reality. And I decided I needed to find my cane from my junk drawer yet again. And people who are visually impaired, I spoke at the Foundation Fighting Blindness Visions conference this past summer. And they always ask me, well, so how did you start using your cane? What was the way that you went about it? And I think we're all looking for sort of a quick fix or a quick answer to how to make it easier, how to make anything easier, particularly the things that challenge us most. And so I said, well, if you want to follow by my example, the first 6, 7, or 8 times that I used my cane, I cried. So I walked down the street, I'd unfold my cane, and I'd start crying. And anywhere I went, anywhere I used my cane, I'd get off the subway. I was looking for a friend's apartment in Soho. I saw this very sweet, lovey-dovey couple. They saw a woman crying with her cane, which in New York is not that unusual. And they said, you know, can we help you? And I said, oh, I'm using my cane for the second time, and I'm trying to find whatever street. And so they were very friendly, and they guided me in the right direction and practically walked me there. And then I thanked them and told them how much I hated them for being so much in love. And So I used my cane many times after that, and it was a real struggle because I could see the people who were looking at me. And I realized, are they looking at me because they're judging me? Are they looking at me because they think that this is not what a blind person looks like? Are they looking at me? And it didn't matter. My mind was going wherever it was going, and I used my breathe in peace to get me through that, and it didn't work. So one night I closed the door to my office, and as I closed the door and I made my way to the corner, and I waited for the crosswalk to turn to change, it changed, and I made my way to the other side, and just as I had reached the sidewalk on the other side, I realized, oh my gosh, I'm not crying. And not only was I not crying, but I realized that I was walking a lot faster, I felt a lot safer, and I was able to see how much this cane was working to my benefit. I got so much more information from using this cane, particularly where my vision is its worst, and that's right below me. So, I was fortunate enough to get a job at the School for the Deaf in Brooklyn when I graduated from Columbia, and I'd learned sign language, so I was able to master my sign there, and this is not necessarily related to vision, but it's something that I like to tell in my talks, and that is, one of the things that I love about the deaf community, and I never knew this, and I don't know how many of you work with the deaf-blind, but they're really a fascinating community, and this is really just for the deaf community. But I was standing in the hallway one day, and I was just talking with a teacher, and we were communicating about our weekend, and we noticed that a woman, she was an interpreter, was walking down towards us down the hall. And then we noticed as she made her way closer that she looked like she'd gained a considerable amount of weight. And we thought, well, we haven't seen her in about 4 or 5 months. And so she approached us, and Ruth, the teacher I was talking with, said, "Hi, Stacy, it's good to see you. You look like you've gained weight." So just so we're clear, as hearing people, if we see someone that we know who looks like they've gained a considerable amount of weight, like we might tell our best friend, we may tell everybody we know in common, but we will not say something to that person's face, right? And so I thought, what did I get myself into here? So Stacy said, yes, I have gained weight. I've been eating emotionally because my husband died recently, about 5 months ago, and I've been very, very depressed. I'm so happy to be back in school now where I can socialize with my friends. If everybody spoke like that, as a psychotherapist, I would be out of a job. Right? And it wasn't like Ruth asked her because she was judging her, saying, you look fat or you don't look like you've been taking care of yourself. She was asking her because she was genuinely concerned. She looked like she'd gained a lot of weight, which she had, and she wondered why. And then she asked her, well, let us know if there's anything we can do to help you, or come have lunch with us. And it was so refreshing. There's such a lack of pretense, such a lack of superficiality, and it really allowed me to appreciate how much being a part of the deaf community has enriched my life. So I teach spin classes, and people say, well, as somebody who has RP, why would you be in a dark and noisy room and teach spin classes? Like, they think, oh, that's so inspiring. I became a spin instructor because I wanted a free gym membership. Like anybody else, right? So that was a fundraiser event that we did. CrossFit, okay. So look how strong my arms look. So anyway, people say, well, why do you maintain your physical activity? Why are you so physically active? And the truth is, my vision and my hearing are two senses that I'm losing that I can't control. And I was told that I was never going to be able to walk properly again. And like many of us in this room, I walk around with constant pain all the time from the injuries I've sustained. Being able to strengthen my body, to maintain my physical strength in other aspects, has been such a huge part of empowering me, of allowing me to sort of take back some of the control that I feel like I have been losing as I've continued to lose my vision and my hearing. And it's really been a tremendous way of me keeping myself from being injured too seriously, especially when I'm more prone to injuries. I've caught myself. This is me doing some of these races. Oh, cochlear implant. Okay, so I got a cochlear implant. I'm going to hustle here. I think I'm running out of time. Okay, so in terms of my hearing, and this is actually a picture. I just come out of my cochlear implant surgery. This was about 2.5 years ago. This is in the recovery room. This is an interpreter they sent to sign to me. I was so hooked up on drugs. I can't even wear my glasses right because I have this like bandage on my head, and she's signing to me as I'm nodding off the whole time. It was comical, not at the time, but now. And anyway, so I was tested in my right ear, both ears, but my right ear, without a hearing aid, tested at 26% discrimination. 26% of the time something was spoken to me, I could accurately repeat back what was said. With the hearing aid, 28% of the time I could accurately repeat back what was said. Clearly the hearing aid wasn't doing me much good. I decided to get implanted, and about a year or so afterwards I was retested and my hearing was at 94 to 96%. So I have a tendency always to sleep with my lower lip like this. It is so unattractive, and it's why I'm still single. Just kidding. Which I am, by the way. Okay. So, the cochlear implant. My left ear is not yet a candidate, but when it is, I will definitely get implanted. Digital hearing is much different than analog, thank you, analog hearing. And so I'm very happy that I still have my analog ear. My auditory skills on my left side are still really help me be able to sort of understand music and really hear it as well as I used to, even though I need to really put the volume as high as I can to hear it well. So one of the other things that Caroline, my best girlfriend, who's here in the front row, she's going to raise her hand. Yeah. She is phenomenal. Everyone needs a best friend like Caroline. So Caroline and I, when I went on further to get more rehabilitation training, I went to the Helen Keller National Center on Long Island. And when you imagine this place in your mind, you think of some place that's probably stuck in the 50s or 60s, and that's exactly what it looks like. And so we went there, and when we were there, we saw deaf-blind people communicating with tactile sign. And this is what tactile sign looks like. It is such an intimate, beautiful, beautiful language. And I always encourage people to YouTube it just to watch people. But this is me actually at the Visions Conference. This is a deaf couple, and the one that I'm signing with here in the glasses is deaf-blind. Okay. Okay, you get it. So I wanted to show this example because tactile sign is such a beautiful language. And if you notice, I bring his hands to my chest and my hands to his chest. And it's not inappropriate or sexual in nature by any means. It's simply the way you communicate when you have to use every means that you have to communicate as well as you could if you were communicating verbally. And it's such a wonderful language, and I'm so glad that I was able to learn that. And it really comes in handy, particularly for me now, as I find myself in very dark environments. Caroline's able to tactile sign with me, and I feel like I'm always able to have access to information. She's kind of like my guide dog in many ways. Sorry, I mean that nicely. Okay. Oh, Kilimanjaro. So this last July, my sister and my stepmom and I climbed Kilimanjaro. It's about 3 degrees at the top. And it's one of the hardest things I've ever done, and I'm happy to tell you more about that if you care, just not now. And the other thing that Caroline and I did 2 weeks ago was we did the Alcatraz Swim for Sight, and it was to benefit research at UCSF For those of you who know Jackie Duncan, maybe you do, maybe you don't, she's an ophthalmologist. She's the head of the advisory board of the Foundation Fighting Blindness. She's my ophthalmologist at UCSF. She is phenomenal. She is so wonderful because she's not just a clinician, she's actually like a friend. I call her Jackie, which is weird, I know, but she really, really allows me to feel my emotions when I'm in sessions with her, and when I'm being tested by her, when I'm being evaluated. And one of the things that's so important for you guys to remember is that when you see someone in your office, particularly when you're doing the testing, the visual field exams, you're likely seeing someone on what they consider to be like the worst day of their life. And I know that sounds very severe, but if you can imagine going into an office, no matter what test we take, any test we take, we always want to do well on it. Even if failing could be to our advantage, we still want to do well on it. And so when you go into a testing booth and you're sort of put on the spot and you're using everything you have to be able to see whatever it is you're being tested for, I give you guys so much credit for having to deal with that day in and day out, back to back, and still somehow be able to maintain your professionalism. And I say that because this is what happens to me each time I go for my tests. It's my most dreaded day of the year. And if somebody cries in your office, there's nothing you can say. I wouldn't ignore it. I would offer them tissues, give them tissues, and say something like, I'm sorry, I know this is really difficult for you. And that's really all you can do. But recognize how they feel, because it's a really crummy feeling, but it's just a part of this whole process. We made it to the top. Oh, okay, see, that's me, the little green right there. In case you didn't know, there was a shark attack about 4 weeks earlier. So being in open water was not scary at all, especially because I didn't have my ears on, and my goggles were so fogged that I essentially did this whole swim blind and deaf, which is a whole other ballgame. We made it! All right, so anyway, I have to tell you how, this is a talk that I usually give that's a little longer, but the importance of friends and family and community. When you see patients, you always want to encourage them. I'm very fortunate to have a very close-knit family. We're all crazy, like everybody else's family. But for people who don't have as much immediate support in terms of their family, I always encourage people to seek their community in their greater community, because there are people who struggle with what we struggle with everywhere. And now that we live in a digital age, you can find it much more easily. It is crucial. It is an essential part of having a condition like this, is being able to have resources and networks, people who you can speak to who really understand what you're dealing with, and not just another professional who can tell you what your diagnosis is and what your likely prognosis will be. My older brother, me and Caroline, my mom and my grandma, my 98-year-old grandmother. I was just named a Lululemon ambassador. And what that means, I don't really know what that means yet because I have my training next week, but it means I get a lot of free clothes, and that's the point, okay? Anyway, this is significant because this is the first time that they've really had someone with the type of disability that I have in this type of role. And it is going to be my goal to really make sure that we have resources for people who are visually impaired and hearing impaired to know what types of fitness classes they can take that are most suitable for them. Okay, so I just want to close by thanking you all for being here. It's definitely such a pleasure to be able to speak to people who work with people like me on a daily basis. I know that sometimes when we do something constantly, we become a little disconnected. And I'm hoping that in some way this talk can sort of reconnect you to the people that you work with. It's so important for you to remember that these people are just like you. They're just like any of us. And that your support, you're sort of the front line of support when they go through their testing and their diagnosis. So anyway, thank you so much for the work you do.